Arthur Lau reporting from roomnow.com from ACR 2019 from Atlanta. I want to give an update on a very interesting oral presentation that I heard today on osteoporosis, which was a subgroup analysis from the FRAME study. Just to remind everyone, the FRAME study was a phase 3 randomized controlled trial in postmenopausal women where patients were randomized in the first year to placebo or Romosozumab, and everyone crossed over to denosumab in the second year. So this was a subgroup analysis looking at degrees of chronic renal disease in patients of the study. So they broke down the renal disease based on mild with an EGFR 60 to 89, moderate 30 to 59, and severe 15 to 29. Of note, the vast majority of patients were in the mild to moderate group. There were very few patients in the severe chronic kidney disease group. Overall, what they showed is despite the varying degrees of renal dysfunction, the improvement in bone density at lumbar spine, femoral neck, and total hip were quite similar between the groups, and the percent reduction in new vertebral fractures at 1 year were similar between the mild and moderate groups of renal dysfunction as well. Because there were so few patients in the severe renal disease group, they were unable to have any analysis from that group. But overall, and in terms of safety signals, there was one case of severe hypocalcemia in the placebo group and one moderate case of hypocalcemia in the Romosozumab group at 12 months. So it didn't seem like there was any significant safety concerns with hypocalcemia like we do worry about with denosumab. And in terms of worsening renal function, there was no significant worsening renal function between the Romosozumab and placebo at the 1 year mark. So for me, the take-home message is we know the efficacy of this drug from that's been reported from previous conferences, but now we can see that in terms of breakdown based on varying degrees of renal dysfunction, there seems to be maintained efficacy even up to patients with moderate renal disease. The only limitation for the study is there's very few patients with a severe renal dysfunction with an EGFR less than 30, so it's hard to extrapolate how to treat those patients going forward. Otherwise, thanks for tuning in, and for further coverage of ACR 2019, tune into roomnow.com. Thank you.